Diagnosing toothwear for students. What is toothwear? Toothwear is the loss of tooth structure through many different processes such as chemical processes or physical processes. Toothwear is the third most commonly observed condition where it affects the enamel and the dentine, which causes functional, aesthetic, and psychological implications. Types of toothwear. There are three types of toothwear. Attrition, which is a mechanical process through tooth-on-tooth contact which breaks down the tooth over time. Abrasion is a mechanical process where the tooth is worn down by something other than another tooth, such as aggressive toothbrushing. Erosion, which is the introduction of chemical processes that are particularly acidic onto the tooth structure, which over time wears the enamel down. How to diagnose toothwear. One of the best ways of diagnosing toothwear, particularly as dental students, is using the basic erosive wear examination, also known as BEWE. The BEWE is a rapid form of assessment which should be conducted on all patients that are on the dental chair. The way to conduct the assessment is to split the mouth into sextants like you would in a basic periodontal examination, where you note down the greatest affected tooth in the sextant. Each sextant is scored by a number from 0 to 3, where 0 indicates no tooth wear, 1 indicates initial loss of surface texture, for example, loss of incisal edge or cupping of the cusps, 2 where there is a distinct defect affecting less than half the surface area of the tooth, which can be highlighted by distinct cupping and pitting of enamel, and 3, which is the hard tissue loss affecting more than 50% of surface area, where dentine involvement is now common. To get an overall BEWE score, you total up the scores of each sextant, where scores of 0 to 6 is seen as low risk, 7 to 12 is seen as moderate risk, and scores of 13 and over is seen as high risk. So, how do you diagnose toothwear? Diagnosis is made up of 3 parts, which is the extent, severity, and original etiology. To write a complete diagnosis, you need to identify the type of toothwear observed. For example, if it's attrition, erosion, or if it's abrasion. The risk status of the patient, which is gathered from the BEWE, if the wear observed is generalized or if it's localized, and the etiology of what caused the wear, i.e. stress, diet, or parafunctional habits. Here are some examples of diagnosis. So, how do you manage toothwear for students? So, here's some examples. The first one is 2.26% sodium fluoride at least 2 times a year. Restorations, which can help the psychological aspect of the patient. Monitor, this can be done by using study casts or clinical photographs. Prescription of high fluoride toothpaste and appropriate mouth rinse. Changing harmful habits such as diet or nail biting. Help managing stress. And appropriate oral hygiene instructions, such as the modified Barts technique.